Hola, ¿qué tal? Muy buenos días a todas y todos los que
Well, good
estamos.
morning, everybody. Good morning to everybody here present. My name is Rebecca Rodríguez, and I am working with the CDM, the Center for Migrants' Rights, CDM. Welcome, everybody. We will be talking today about the experiences that we've all had in digital outreach from the CDM. Currently, I am working in the coordinating digital outreach and promotion. And let me tell you a little bit about CDM. And for that purpose, I would like my colleague Ricardo to show the presentation. And well, let me just remind you this section. Please silence your microphone. If you are not talking, you can activate the microphone whenever you have a question, or raise your hand ideally if you were to have a question. Also, if you have an idea or you want to participate somehow throughout the presentation, well, you can just raise your hand, or you can also text or send us a message through the chat feature at the bottom of the screen, like you have been, some of you have already been doing for this few minutes. Somebody is always monitoring the chat to make sure that if there are any questions or comments, and so that this training is more interactive. So who are we? CDM is a civil organization, nonprofit, that defends the rights of the migrant communities and people in the United States. We're expert in laws related to work, and we work a lot with the people in Mexico migrating to the United States, or people already inside the United States and facing some sort of issue at their place of work. We have offices in the United States and in Mexico. I, for example, am in the office in Oaxaca, Mexico, Mixteca, Oaxaqueña, and also we have another central office in the city of Mexico, and one more office here in the United States, in Baltimore. And so with this, let's go on to the next section. And we will talk a little bit about the agenda for today. We will be discussing for the next 90 minutes, like it was mentioned by Lupita, and we will also be talking about the work that we do, and we will be talking about our digital outreach. We will be sharing experiences based on what we've experienced at the CDM throughout the pandemic. And we will talk about good practices that have been very resourceful or useful to us. And now I leave you with Ricardo, who is here with us today, as we're going to conduct an activity to learn to know who we all are. Welcome, everybody. Thank you, Rebeca. Well, good morning, everybody. My name is Ricardo Ortiz. I am the digital organizer for the CDM, and I am very happy to be with all of you here today. I can see that there are more than 80 people already connected here through this platform and in this conversation. We want to make this conversation a very dynamic one. We want to get to know you all to see how we can collaborate in the future as well, right? Since we have already 80 people, we would like at least 3 of you to volunteer and share by opening up your camera and opening up your microphone to tell us what your name is, where you live, and what do you do? Where do you work? The rest of you can just share it through the chat if possible. You can write your name, where you live, and where you work. Please help us with that. In the meantime, is there anybody who would like to share this openly, either in English or Spanish? And here we have a picture because we like the contact with people, and probably you guys are also very close to people, and since we cannot hug ourselves because we're doing this through this digital platform, this is a virtual hug to all of you, and because of everything that we have been through in the last couple of years. So Here in Mexico, well, I'm in Baltimore, but in Mexico, we like to hug. We like to hug people a lot. So if anybody wants to share what their name is, where they live and work. And let's see who opens up the cameras and microphone. I am Mariana Sabella. I am in the state of Wisconsin, and I work for an organization that works jointly with an Asian group called MOM here in Wisconsin. Our group is called NH2N, Hispanics and Asians working together. I work as a coordinator, and then also I help people with the Ministry of Health. Thank you very much for the information. I didn't even know that there was an office for the rights of migrant populations in this part of the United States. Yes, we have offices, and I actually am in Baltimore. And if you need any form of support, we can help you very happily. Yes, my name is Arlen Caro. I live here in Arizona, but the office that I work in is in Somerton. We are an agency, and our agency is called Farmworkers with No Borders, and we help people with little resources. Thank you very much. Anybody else that would like to introduce themselves? You can open up your camera and unmute yourself. Well, good morning, everybody. My name is Vanessa Silva, and I'm here in the state of Wisconsin as well. I work for the Family Health Centro, which is a community health clinic. We provide financial, medical, dental assistance to all sorts of people and families, but we work a lot with Hispanic populations and also temporary workers. And so here we are serving in the state of Wisconsin. Thank you very much. Thank you, Vanessa, for joining this conversation. I can see that there are a lot of people in the chat also telling us that where they come from. I hear North Carolina, Chicago, and we're very happy to be able to share this information with all of you. And by the end of this talk, we will be sharing the campaign which relates to health. And so I'm very happy to see how many people work with our communication in health. And well, when you want to share your information in the chat, please add it. And now, Rebecca, please proceed. Well, thank you very much. And yes, I'm very happy to see how many people are here with us today. I am very happy to see your faces. Unfortunately, I will not be able to turn on my camera throughout the presentation because my connection is not very good right now. So there's a picture of me. And I have a very good story about this picture. Actually, our legal director always says that this picture is about to talk to you, but it just seems funny. And so I'm very happy to be sharing with you. And now we will be discussing what basically we're here to do, and that is the digital outreach. So we have mentioned this word for many times already now since we started this presentation, but I would like to have a brainstorm activity with all of you so that you tell us what you think this represents to you. What is digital outreach to you, basically? I'm going to be sharing a link to an application that's called Jambar, and I'm going to ask everybody to participate. So please add in Jambar the first thing that comes to your mind when you hear the word digital outreach. There's the link for Jamboard in Google. So what do you think is, what is the first thing that comes to your mind when you hear the word digital outreach? Because I believe that we at some point have all heard this. We all have at some point done some sort of digital outreach or have some idea of what this is.
Y bueno, pues es genial. Creo que todos son muy buenos en estas herramientas.
And I believe we're all very good in these tools, right? Okay, and let me interrupt. If there is anybody here in this conversation that doesn't know how to use the Jamboard, you can just leave us a comment in the chat, and then we will share this on Jamboard with you. And there's also a sticky note there. Somebody was talking about digital outreach online.
Uso de medios sociales. Gracias, Mariana.
The social media.
Uso de medios sociales. Hay una segunda hoja por si acaso.
So there is a second page there in case we don't have enough space. We have a second page. And so we can use that second page also to add our ideas.
Mucho gusto, Rosa. Bienvenida.
Very nice to meet you, Rosa, and welcome.
Excelente. Pues veo que tienen pues completamente toda la idea de qué es outreach.
I see that there's a lot of information about what is digital outreach.
Establecer relaciones con su público final y entablar
To
relaciones.
establish and create relationships with clients and with providers.
Sí, perfecto, Mariana. Muchas gracias. Damos un minutito más para que los demás terminen de escribir sus ideas.
We're going to give it 2 more minutes. I see that there are several ideas still they're pending. Groups in WhatsApp.
Que sea accesible, televisión, Facebook.
Facebook TV.
Uso de la computadora,
Using the computer.
Educativa por redes sociales y páginas web. Redes sociales, correos electrónicos, videoconferencias.
Networks, video conferences, promoting educational information through the networks, text messages, Facebook information.
Tenemos algo en la segunda hoja.
Very good. We have something else on the second page.
Claro. Perfecto. Muy bien.
Let's see.
Bueno, pues
well, very good. Well, thank you everybody for this activity. The truth is that I believe that we have a very knowledgeable audience about the digital outreach because, yes, most of you are right in everything. Many of you are right in everything you said. Everything we do has to do with technology, digital technology connections, and those are part of the tools that we use in order to have a digital outreach with the people that we have as an audience. And so at CDM, for us, it is a promotional strategy and creating effective identity within the migrant population, which is our target population. By using these tools as digital tools to defend the rights and to improve the conditions of these and the working conditions of these people for people who are working with H-2A visa or migrant populations. And so thank you very much for helping us with this exercise and for the ideas you shared with us. And now we are going to look at how we basically, I would like to share my vision, which was to create relationships through communication, digital content. And one of the things that I saw that somebody was sharing was in building relationships with the migrant populations. And just like Ricardo said, right, we can hug each other and talk to each other, but we are trying to do this through digital means so we are able to interact with the populations that we work with, interchanging values, knowledge, ideas, and information. So thank you very much, Christine. Oh no, don't worry, we're just starting. You have not missed a lot, anything actually. You're all welcome and we are just starting. So we are still on this session for the digital outreach. Well, many of you spoke about working with organizations that provide health services. And so we have a vast audience. And so we have a format here about what has worked for us at the Migrant Rights Center and how we do digital outreach with the people. It is always important, for example, to see who is our audience, our target audience. Like I heard right now, some of you work with different groups of people, different audiences. In health, we work more with rights. And so it's important to identify who our target audience is. But many times we have to focus directly on one audience specifically. We need to define who our target audience is, the one that I want to reach or who I want to communicate with. Once we have that defined, our target audience, it is important also to decide or see and find where these people are. Because we know, for example, that people go where they work, right? They might be in different locations physically, but many times we don't know which are the digital spaces or the digital communities where we can find them. So it is very important also to see where these people are, and this part of where my people are is going to help us define steps in order to do promotion with these people that we want to reach. So how do we get to them? How do we reach them? It's important to define, for example, if they are using some sort of social media. We have been discussing a lot about Facebook. Most people do have Facebook. I have met even people who are like in their 50s, 60s, 70s, and they are using Facebook. They have found a way to integrate this into their lives. Especially now during the pandemic, we've seen the need, the increasing need to join other social medias, to raise your voice, to share with others, to have access to information and all the needs that you have on a daily basis. So older people have found a way to look for this information in this means, and therefore they have found a way to use this form of technology. Most people do have a cell phone, and we know that it's very common also to be using WhatsApp in our cell phones. And so we can use also either private or public Facebook or WhatsApp groups in order to reach our target audience. So these are the first steps, and this is basically what we do in the digital form, no? In the digital media, what we do, how we reach to our target population, and else. But then there's another section that is also very important, in which is where basically we're thinking not only about finding the people and the strategies on how to get to them, or the mean that we are using in order to get to them, but it's also important to know which is our objective with these people. What is it that we need? What is it that we want? Because we all have a goal. We all want something in the end. We want a final product. So it's very important to define this, because if we're thinking, oh, I want to reach those people who are trying to get a job because I want to provide them with information. So I'm going to look for these people, and then I can find them in WhatsApp groups or digital campaigns, in radios. But what do I want with this population? What do I want these people to know or do? What is the end product? And the objective with these people is very important to define what is it that we want. Besides, we always want them to do something, like we require them to do something. We want them to learn. We want them to get informed, or I want them also to know a little bit more about the rights, empowerment, being able to share with other people. What is it that I want from them? It is very important to establish a purpose for the outreach. Because what if you only want to share information or share the lack of information that there is about employment resources or work? Do you want to empower people about a topic so that they have a greater role? So it's very different than just saying, oh, we need to share this information and it's here available. And maybe the information will not go any further, but sometimes we can share this information and share information, empower them, give them strategies so that they can share this information with other people. And so in this case, they can have a role, a more proactive role than just getting or obtaining the information and keeping it for themselves. This will allow us to create a community, a commitment on our targeted population and a common interest with ideals to take on action and fight and improve in the topic that we're working on. And this goes hand in hand with what we require from them and what I want as a final product from the people who, from what the people can accomplish with us. So all these steps are very important, and I would like you all to consider where is that our populations are, what I want from them, and how do I reach them. In this, in our organization with the Migrant Rights Center or CDM, our target population are those people working, migrant workers working with an H-2A visa or not. And so it's important for us to define it clearly, because at times during a campaign or workshop, you need to reach these people. If we are conducting a workshop on the rights of people under the H-2A visa, we need to obviously make a call for the people who have had experience with the H-2A visa or working under the H-2A visa. Because it wouldn't be a good idea to have somebody in a workshop with an H-2B, I'm sorry, an H-2B visa, because that would not be the topic of our training. Also, there are virtual spaces like the WhatsApp groups where they have presence, and there are many people creating virtual communities besides the physical spaces that are available, which we might kind of know where they are. So it's important to define this and also the outreach strategies for our audience. We can do even surveys in Facebook, campaigns in WhatsApp, radio programs. So this part is very important. Okay, thank you. So far, are there any questions, any comments? Okay. So once we have this foundation and the basic questions that we've presented so far, we'd like to conduct a short exercise with every single one of you. We are going to be creating breakout rooms, and that's the reason why I wanted you to rename your preference in language so that we can have a reflection of this exercise. Are we all ready? Does anybody have any questions, comments? Okay. So let's go to our breakout rooms where we will be there for 10 minutes. And so the idea is that we are able to reflect and think about where is that our target populations are, the people that we work with, the people that we want to do outreach with, or the people that you want to educate. Where are these people? considering and taking into consideration the base questions on how we would reach them. So to create like a short plan with our target populations.
Unos 2 minutitos más, pero ya casi.
In 2 minutes, we will go into our breakout rooms. Thank you very much.
Súper bien. Bueno, entonces, pues espero que les haya gustado comentar y participar en los cuartos. Me gustaría escuchar a 1 o 2 grupos de las ideas que surgieron, que quieran compartir con nosotros y nosotras. Creo que están regresando apenas algunos, entonces.
I believe people are coming back now. María Castillo, we will start with you.
Sí, nosotros platicamos sobre la audiencia.
Well, we were talking about,
Target, ¿verdad? ¿Cuál es nuestro objetivo con estas personas? Es de que
and we were talking about the objective with these populations
low income, los demás bajos recursos, ¿verdad?
and the target of the low income is when we want to provide them with information about healthy food. We provide them with flyers, information about the vaccines, how important it is for them to have the vaccine. And also we provide information about transportation and other resources. As somebody said that they are from Wisconsin, so we can, oh, in Wisconsin, they mentioned that they have a podcast so that the people in rural areas can use this podcast and find information about the resources available. Our colleague Edmund from Alaska also mentioned that they share emails with the different partnerships, flyers, posters, and that is how they help the community, the people with the lowest resources, immigrants, and also knocking doors and going to community events. Well, thank you very much for sharing, Maria.
Puede quitar el mudo y dirigirse a la plenaria directamente.
Hi. Hola.
Hello.
Adelante, adelante.
Yo también soy aquí de Alaska.
I'm also here from Alaska.
Nosotros trabajamos
And so we work.
community health work.
I am a community health worker.
Trabajamos con la comunidad.
We work with the community, refugees, and asylum seekers
De todos los países.
here from all of the different countries.
Mi trabajo por lo menos se enfoca un poco más en la.
But my work at least is more focused on the people who speak Spanish, because at the beginning that is very difficult. And
El idioma no está como le digo,
how can I say this? And the language here, people don't have a lot of access to the language, and obviously not everything is in Spanish or English, so that is a big barrier here, the language. And so I work with these people, helping them with their applications,
información de salud,
information for health.
y pues en la temporada de COVID, pues hasta
And then during COVID, well, we even went to explain to them
en español,
what it meant and what it was.
tener más acceso o entender más todo.
And so that they are able to understand more about the health and the resources available, and many resources that they don't know that even exist.
Muchas gracias.
Well, thank you very much. Thank you, Daisy. And I hope this is how you pronounce it, right?
Muchas gracias por compartir. Igual y les invito si quieren escribir algo que hayan visto en los grupos.
Well, thank you very much for sharing.
Si quieren compartirlo,
If you want to share the information that you shared during the breakout rooms.
Adelante. Creo que se estaba cortando un poco, ¿verdad?
It was cutting off my communication, I believe.
Y antes de pasar a lo siguiente, Arlen, ¿quieres compartir
Okay,
algo?
and then Arlene, do you want to share something with us as well? Yes, in my group, I was here with Adriana Taylor and other people besides Ana. We were talking about who are our target audiences, and basically the people that I work the most with are farm workers, agricultural workers, and we share the same with other people in the group. Adriana was also telling us that she doesn't go out to the field that much, but her agency does try to find a way for them to come to us, to them as well. In the chat, there was this other person who was also telling us about how they work in New York and with people who didn't have documentation and people who had the visa H-2A. And so we go to these people, we share.
Buscamos los lugares específicos donde esta gente siempre estaba para poderles ofrecer la ayuda.
Muchísimas gracias, Arlen.
We go to the people, we try to go to the people a lot. Yes, thank you very much. Thank you very much for sharing that. We're very happy to hear who the target populations are, because this is basically what we're going to share based on our experiences. Specifically, us as an organization, we work with temporary workers, people who come in with an H-2A visa or an H-2B visa. In case you don't know what are the names of these visas.
Sí, gracias. En el grupo que estuve.
Yes, Rosa, thank you for sharing. In my group, there were 10 people, but 3 of them shared information about health because they work at a clinic. And for some reason, they are not, their target population doesn't believe in the social media, so it's very difficult for them to use these. Another one mentioned that she works at a clinic, but the clinic allows them to go with them and as companions when they are having events so that they can share the resources. We are here in the state of Oregon. I work for the Virginia Garcia Memorial Center, and we have a program which runs basically from June to August, and we go out on the field where there are a lot of people with the H-2A visas, besides other people who come from California and Washington.
Servicios médicos y dentales.
We bring them medical and dental services for all the different counties. Then we also have the participation of over 50 agencies in the community within the 2 counties. Not always they attend, but it is a big event where we provide the resources. We also have a partnership with the Pacific University, and they provide eye tests or eye exams. And the way that we do the outreach with these people is because the clinic has a social media office, they do YouTube, Facebook, and else, but also our department that does community outreach. We personally go out on the fields and where they work. And so we bring them our mobile clinic to provide services, and there are medical providers, agencies, volunteers, and there's a large number of staff whenever we do this clinic. We also give them transportation because many of them, especially when they have an H-2A visa, they don't have transportation, so we give them rides to the clinic back and forth, and we give them medicines whenever we go out on the field, and all medicines or drugs are free. And well, that is the way that we communicate with the different farm workers or ag workers. But we have 5 clinics that we have, and one of them specifically is multicultural because we have all sorts of nationalities there. But we also have a women's only clinic, and so we are here to open to help you if you need any tips, advice, and else. And we are also happy to receive help from all of you. Well, thank you very much. And then you allow us to continue sharing all of these experiences. And we have different similarities. We have similar similarities. Because when we do outreach in person and in contact with the people, it's different from when we do this virtually. And so I believe that for all of you, everybody who is right now with us here, whenever this pandemic started, we were all in shock, right? First, because we started looking at this information that the COVID-19 was highly transmissible, coronavirus all throughout the world. And then we didn't know what it was. The only certain thing was that everybody had to go into lockdown. We all had to working or staying from home. And those of us who had the privilege to stay at home, because I know that for the people out in the field, this was completely impossible. But most of us had to like stay at home and lock down. But when we wanted to support our population, we ran into issues. And that was the main problem we identified. The main problem we identified during the pandemic was the virus itself, coronavirus, right? And now, and since you've already started sharing this throughout the conversation that we've been having, what are the differences, right, between doing digital outreach and in-person outreach? And here we have some ideas. If there's anybody who would like to share this in the chat, we can go read them. We can be reading them. But in person, well, you get to meet the people and you make this connection, right? You know, you get to see if the message is getting through the people, if they are having any need. You get to see the reactions, right? Nodding their head or crossing their arms and like they don't want to be receptive. But then also, there's a disadvantage. Some people don't want to listen to us, don't want to open their doors, don't want to be receptive. So that is the problem already there.
Hacer alcance infinitamente, ¿no? Les comparto que de octubre a marzo de este año, octubre del 2021 a marzo de este año, nosotros en nuestra campaña.
But with digital, what happens? With digital, we can reach more people. We have, in this short period of months, we have reached over 70,000 people. I believe that that is something that used to be very complicated, considering that we have a very limited staff. But that's one of the advantages with the digital means, because we can get to more people. But yes, we're missing the in-person connection, to look at the people in the eye and to be able to see them in person. Some people don't even show their pictures when we're in digital means. So that is already, you know, a big advantage to do things in person. Another of the problems that we have identified is that there are a lot of people, especially communities of origin, who don't have access to the social networks or access to internet, like my friend Rebeca, who has issues with internet at times, which comes and goes. So that is a big problem that we find in digital. In person, you don't never face that issue, no? There's no digital breach or digital gap. In person, the other issue is that there might be environmental problems or issues with transportation. So those are like pros and cons. Another one of the issues that we also find is that sometimes people are not familiar with the technology. Many people that we know even didn't even get to complete their basic education. And so just there you have a barrier, because you want to get to this population, and it happens that this population doesn't have a way of receiving the information that we want to share with them. And so those are only some examples of the things that we have identified. Here we have Glenda, who raises her hand, and she said, in the area where we work, many of the workers only have their cell phone to make phone calls, but they don't have internet. Some of them cannot even read. And that is another thing that we have faced ourselves in the digital gap. In person, you talk to them, you explain. And even if you give them a flyer, you are also sharing the information with them verbally. So what have we done in order to try to solve a little bit of these issues? Well, when we're talking about the people who don't have internet but do have a phone line, we have discovered that many people who don't have Facebook or TikTok or Twitter, well, they use WhatsApp. Actually, there are studies which state that the Hispanic community is one of the most that uses WhatsApp, different from other communities in the United States. So what can we do? We can do bilingual flyers, but then we can also share audios through WhatsApp. And WhatsApp also gives you the opportunity to create groups, which can allow you to share information, but also there are several people who don't allow you to share the information. But through the groups, we can individually send information. So we are implementing a practice where we create videos, but videos that come with their own subtitles and audio. And this, in order to solve this problem that we find in our communities about the people who don't know how to read, but also the people who probably have visual issues or people who probably have listening issues and they can access the subtitles to these videos that we share in WhatsApp. And the advantage of WhatsApp is that the people can share this with anybody. And that is one way of doing this digital outreach through this WhatsApp platform. Another of the things that we are implementing, and actually many of you mentioned it, is collaborating with other organizations. For example, in the group where I was, Edmond told us that he likes to share electronic emails with other organizations in order to share the information. And that most definitely is an excellent strategy that can help us create a greater community. The pandemic has given us, you can say, the silver lining. It has allowed us to create all of this sharing digitally. And in the digital platforms, this might be a little bit difficult for the people who are not familiar with internet. But what we implement many times is that a few days before conducting these workshops, for example, we call our audience, we ask them if they have the application. If they don't have the app, we help them step by step so that they can download the application themselves. We run tests, and that has also helped us so that the population can learn and empower themselves and take advantage of the resources that they haven't had, that in advantages that other organizations and health departments have. And, you know, we help them with the solutions. Another of the things that has been very helpful for us, for the CDM, is that for a while, ever since we were created, I believe, we have hotlines that are open from Monday through Friday, and there we speak to the community a lot. And this also helps us because we are day by day learning about the needs of the people, because they call us from anywhere, or about everything. They ask us about how to apply for an H-2A visa. There's a process. We provide information. And actually, Rebeca has created a wonderful video that we will be sharing with you about the steps. These are very short videos, a minute-long videos, where we share the information. And so these lines also help us to create our outreach plan in the social networks through Facebook, WhatsApp, Twitter, Instagram, or TikTok. Another thing is that we also have an advisor committee. And this has helped us a lot with our program because with our health program, because these people who belong to the committee are leaders in their own communities. These are people that already know us as an organization, and that we know that they are empowering their communication, their community. And so we present to them the content that we have for social networks, and they make suggestions, recommendations, and also at the places where the workers are and have direct communication, they tell us, we need this information, we need your support on this topic. And that has been very helpful to us and to be able to reach more people. Because sometimes You might have some ideas or you might have some proposals, but many times there are some basic details that we need advice on, like what illustrations are we using, or what does this might be represented for our target population? How do we, what drawings or what sketches do we need with this information? Because in Mexico, the word, even for something such as simple as a mask for COVID, in Spanish, is in Mexico, it's called cubrebocas. In Latin America, it's called mascarilla. So, you know, those things that will allow us to share with those people who need this the most. Something else that helps us is that we are on a daily basis responding to all of our messages through WhatsApp and checking the comments through the different social media platforms and posts. I know that this is a lot of work and it sounds complicated because in some teams, especially, we're very few. But in this case, Rebecca and I, who are more responsible of social networks for the CDM, we split the obligations. One checks in the morning and Rebecca checks in the afternoon, for example. And we are responding individually each of the questions that they ask us, because that allows us also to understand what information our community needs. And now I'm going to read something about some of the comments that I have been receiving here. I believe somebody has a mic.
Ningún problema. Gracias. Y
turn it off so that we can continue. And so I'm sharing about okay, it seemed to be some background noise in the English interpretation channel. Okay, we will be sharing some more information about the populations who are resistant to vaccine, because there were so many myths about vaccination. Some people even asked about a fetus being used for the vaccine, and that they're putting chips in the vaccine to control the population. So we did a Tuesday fact check session. So we took a hypothesis that the community had. We did an investigation. We based a lot on the information provided by the CDC in the United States or the World Health Organization, and then we answer through a chart like this with all the information. This one that I'm showing to you was the first fact check that took place on January 10th this year. And this one specifically was about COVID vaccines, and was asking if the COVID vaccines would get us or would bring more variants. And as you can see, it has had more than 1,000 interactions. It was shared 94 times. And besides that, we received a total of 331 comments. Each one of these comments we answered or we replied back. And this has been very helpful to generate communication with our community.
Personas de nuestra comunidad que empezaban a desmentir este tipo de cosas, que nos compartía por qué se decidieron.
There were well-empowered people in the community who started telling us why they decided themselves to take on the vaccines. People would check all of the comments. I was surprised that the most recent comment was number 331, and people kept answering. So this was one of the most recent ones for the Tuesdays of fact check. And this one, for example, was about using the mask. And why did we do this? Because there was a lot of resistance in our community and a lot of myths around the vaccine. People saying that the vaccine, what it was doing, it was generating more virus and affecting us all as a community. That's why a lot of people were refusing to wear a mask. So we did this fact check. Can you wear a mask for a long time and it will not affect you? And yes, you can see we had a lot of comments. It got shared and a lot of comments were there.
Pues muchas personas, ¿no? Que los van a estar haciendo comentarios negativos. Lo que nosotros hacemos para este tipo de comentarios, o incluso hay comentarios bastante...
It is worth mentioning that a lot of people would make offensive, negative comments or slurring and else. what we do is basically we hide those comments and then we continue with a positive conversation with all the people who are respectful and are not using those bad words or negative messages. Those who are basically respectful to the community, regardless of if they're in favor or against the vaccination or using a mask.
Implementando mucho es que hacemos cada mes Facebook Live. Y
another thing is that every month we do Facebook Lives, and when we do a Facebook Live, it's completely different than having a workshop like right now we're doing in Zoom, because we're having like a conversation with people, we allow them to talk back, but then in Facebook Live it's different because they can share only through their comments, and that has also brought us to the populations anticipate that every month we will be having this Facebook Live and we will be answering their questions. The only recommendation for a Facebook Live is that you need to be periodical so that the community can identify you and know when this will be taking place, and you can also identify your audience, the followers, which in the end is going to translate to shares and views. We have received some comments from people who say, oh, about the Facebook Live that you did or the post that you did, I got to share the information during a family dinner, and that's amazing because we're already doing a digital outreach with the people. The people are sharing this information with their relatives, and the people are sharing and call this organization, they might be able to help you, and that's exactly what we want through the digital means. There are a lot of positive things that come with the digital. There's a lot of things that we still need to learn and do, but we can take advantage of these tools. Something that we do, for example, with Facebook Live is use Zoom. You don't need to pay anything else but have a Zoom account, and then through Zoom you can do this transmission, live transmission through Facebook. So before we move on to the next exercise, I want to know if there are any questions, either in English or Spanish. Does anybody want to make a comment? Let's give you a brief moment.
Y si no, antes de pasar al ejercicio, les vamos a compartir también con ustedes el siguiente
cuadro. And so we will move on to the exercise, and I will be sharing this chart with you. This is a format for the content calendar that we use a lot.
Aquí este es el ejemplo, pero
this is only an example, and we will be sharing this with you later. It's been very helpful for us to identify ideas. I know that we always come with ideas, right? But when we need to translate them into something material or practical, we find ourselves with many barriers. So for us, it's very helpful to put our idea here. And then we classify it if it's an information, idea, something inspiring, something fun, or something commercial. Our suggestion is that you always try to vary the information. If you are working in health topics, don't make it just informational. Change and make it something inspirational that has to do with health. Also something fun, an activity that will allow the people to interact and also add comments and have ideas and share the content that is most interesting to the people, or the content that people actually need in order to solve their doubts. In this weekly calendar, basically what we do is that we write on this every week. And this also allows us to be ahead for those holidays or celebrations. For example, here we have the month of January. So in Mexico, on January 6th, is like the Three Wise Men Day. It's a Latin Hispanic celebration, very similar to Santa Claus. Basically, the three wise men come to the house. The children leave a letter and they bring a present for the kids. So it's a big deal. For us, it's important to do something during this day because our population is people who come from Mexico and elsewhere. And so we know that this is a very symbolic day for us.
Ver en México mucha gente que incluso se toma el día para irle a comprar los regalos a sus niñas y a sus niños.
In Mexico, it's a big deal because people even take days off from work in order to get toys for their kids. So what we do is a very simple post like this. Happy Day of the Three Wise Men. There's a girl writing her letter to the Three Wise Men. And the idea was that this girl wanted vaccines for everybody in the world. And our message was, in many parts of the world, the vaccine, COVID-19 vaccine around the world is not accessible for a lot of people. But if you live in the United States, everybody over the age of 5 can get a vaccine. And this was a big part so that our population would understand how important this is and would understand the differences that there are in terms of the access to health in the United States and the rest of the world, or Mexico. In Mexico, there are still children who cannot get the vaccine, but in the United States, it's quite easy to have access to the vaccines for all those older than 5. And this worked very, very well, actually. And so in our calendar, we go like this. We say January 3rd, there's a blog with a graphic about the variant for Omicron. And our objective was to add elements onto this. There was also a chart here to promote the vaccines, the booster shots. And underneath where there was a format, we specified if we wanted this to be a blog, a graph, or a chart, or even we were considering the idea of creating podcasts like somebody explained, which is excellent. And that is definitely one way of doing digital outreach. And so here, basically, we are focusing on Facebook and WhatsApp. But here, I just have one example of what we were doing in Facebook. This has been very helpful for us to have a sequence and organization. You can even, after this, consider which materials you have, which materials could be reused in the future or else. I have included this information in the chart. But now we have an activity for all of you, but apparently we don't have enough time. What we want you to do is basically to start learning about this format and use it as best appropriate. So now I'm going to leave you with Rebe and to continue with other examples. Thank you. Gracias, Ricardo. And thank you very much to everybody who's still with us. And so we're going to share some tips and practices. And basically what we have done with CDM is respond or take care of the needs of our target population and respond in certain questions that we have received through different spaces. We have done Facebook Live programs because of these sort of questions or the needs that we have identified. And so this was the first Facebook Live in 2019. And so we were talking about a prevention campaign. And this is how it started with the CDM. And well, it's been 2 years now that we have had this program. And it's been very, very liked and acceptable within our population. And so also these programs live are periodical. We do one each month, and we invite not only people, migrant workers, but also allies, experts in different topics and else. So that is something that has been well accepted by the people, and because it is something that the people actually need to listen to, and it's information that they can share. Also, we have fashion posts because this is something that will not go out of fashion, information that the population will always be looking for. So this was shared on October 1st, 2021. And in 2 weeks alone, it reached over 70,000 people. So it was a very interesting topic for the people. And there were a lot of advices and tips in how to avoid fraud. And that was a very frequent question that we had back then for us at CDM. And this is something very recent that we have also done. It is a post that has showed, for example, a lot of good results, and apparently people have become very interested in it, because one of the things that we do, and because of the pandemic, we haven't been able to conduct in-person workshops or else. We're starting to go back to the community little by little, but one of the things that we implemented was doing education by digital means, with visual means and little text, just educating people to know about their rights. And also, like my colleague mentioned, the Tuesday fact check, we have the day of the rights, of knowing your rights. So this have been activities well accepted by our audience and that have been shared by many. And well, besides all of these tools and besides these visuals and strategies, we also have a page of contratados.org, where we are providing materials and so that people have access and can answer common questions. Currently in Contratados, we have 2,000 visits per day. So it's very important what we have here, because on the internet page, so that the people can have access to this. So it's very important to have these tools and information available. If I want to learn a little bit more about my employer, if I want to know about what's going on around this topic, it's all in contratados.org, where the people can find the information that is of their most interest. And most recently, we also have the El Portal Migrante, which has been very well accepted and promoted in different spaces and different means with allies or people who have gotten in contact with us, and they are visiting this portal every day more in order to have access or to facilitate the access between an employer and an employee. How do we empower people to have direct contact with the employers in the United States and to eradicate what is fraud in recruiting? And these are some of the best practices that we wanted to mention. And it's very important to know who your audience is, specifically their needs. And like Ricardo mentioned, the defense membership group or advisor group. For all these groups, it's very important to have all of these best practices. And so it's important for us to be able to know the needs, the interests, and especially give an answer to those interests, because the people are important to us, but it is also important to let them know that they are important. So it's important to give them an answer, follow up, like Ricardo mentioned, to give them a personalized answer to reply back. That's very important. The type of language is also very important, because not only we are talking about a language, we are talking about a language that is well defined for our target population. So we need to know our audience, our public, and define the language, the tone of voice that you will be using with these people. That is very important, because we don't want to offend anybody. We don't want to break the respect and trust that they have in us. Okay, so it's important to respect the beliefs that we all have, the different cultures that we all have, the academic level or literacy level that the populations have at work, at home. That's very important to take into consideration. And Ricardo also mentioned this a few minutes ago, that the populations who do not have internet, we have considered using radio with them or WhatsApp, which has been very helpful. And also the people who are illiterate or speak an indigenous language other than Spanish, we have created audiovisual materials that have helped very, very well, especially because many of these indigenous languages are much more spoken than written. So it's better for us. We get a better response when we have like a video or a recorded message, where compared to a written message. Videos need to be very short. And so that they are attractive and also visually attractive. So those are the best practices that we wanted to share with you. I hope that this has been helpful. If you have any comments, any questions, concerns, please send us an email. Our emails are here on the screen, and thank you very much for your participation today and for joining us for the last hour and a half. Well, thank you very much. And here on the screen, you find our information. You can send us an email. We're more than happy to be able to continue collaborating with all of you and sharing ideas that you might want us to go deeper into. Thank you very much.